One. Hello and welcome to tonight's information session on the School of Optometry at Massachusetts College of Pharmacy and Health Sciences. My name is Hannah Campbell. I am Associate Director of Admission here at the university, and I am joined here with a couple of individuals that are associated with our program, including a faculty member and a current student. So I'm going to allow them to quickly introduce themselves, starting with Dr. Imperioli, if you wouldn't mind.
Yeah, I'm Angela Imperioli. I am originally from Canada, so I did my undergraduate work at the University of Waterloo in Canada. I've been at MCPHS for 12 years, full-time faculty for 5 years, previously adjunct and in a group private practice before I started MCPHS full-time. Within my faculty position, I have a unique experience of being able to work with first, second, and third year students in labs, lectures, and clinic.
Thank you so much, Dr. Imperioli. And we also have one of our current students, Budamina, if you wouldn't mind introducing yourself.
Sure. Hello, everybody. My name is Bootsmina. I'm a current first year at the MCPHS School of Optometry. Like I said, I'm a first year. I grew up in the Worcester area my whole life, and I'm very excited to be here with you all today.
Fantastic. And we're all excited to share about the university, about the optometry program, how you can go about applying. And if you have any questions, you can feel free to connect with me after the presentation. I'll make sure to leave my contact info if anyone would like to schedule a one-on-one appointment to discuss their own individual candidacy in the future. So without further ado, we'll get things started. I'm going to start us off with just some basic information about MCPHS. We've been around for a very long time. We started actually as just a pharmacy school back in 1823. So we are the oldest institution for higher education in Boston. But most part, we're going to be talking about our Worcester campus today because our Boston campus is primarily our undergraduate campus. And our Worcester campus is where we started our optometry program. So our Boston campus is definitely a great place to be if you're looking to study healthcare and the health sciences, because we are in the Longwood medical area, which is among a bunch of prestigious healthcare institutions. But we did later expand to Worcester, Massachusetts in the early 2000s to be able to, I guess, have enough real estate to offer some great professional phased programs that require a lot of lab and clinical space within the healthcare and health sciences. So we'll be talking about Worcester as that is home to our optometry program. It's one of our professional phased campuses. So we do have students in 9 different professional phased programs that take place on our Worcester campus. We also have a sister campus in Manchester, New Hampshire, which has some professional phased programs as well, and even a rigorous offering of online degree programs for those that are looking to continue their education once they do graduate from the optometry program. So in that 200-year span that MCPHS has been established, we have grown significantly to have now over 100 programs across these 3 physical campuses in online. So there is a lot of options to continue your education with us. But speaking a bit more about Worcester, we are the second largest city in New England, behind Boston, of course. So we are only about 45 minutes or so outside of the city of Boston, and there is still a lot of great healthcare opportunities nearby here, even though we're not in a Longwood medical area. We are just next door to St. Vincent's Hospital, and we even have University of Massachusetts Chan Medical School just down the street from us. We have a really great partnership with them where we refer a lot of our more complex patient cases over to them. And they also allow our students to collaborate in research with us and have even donated a variety of cadaver parts to our program over the years, and not just eyeballs, things like pairs of lungs and other organs that the students get to poke around at. So really great to have them so close by. And there are 12 other colleges and universities nearby our campus. So Worcester very much is a college town. You're going to be around a lot of like-minded individuals that are also working towards their own careers. And there is no shortage of fun things to do in the area. We border some great event venues, whether you're looking to see like a touring Broadway show or attend an indie band concert or attend a symphony orchestra or even go see Cirque du Soleil. There's always things coming through this city, not to be overlooked by any means, to our big sister, Boston. Plenty of shows to, enjoy, whether you're looking for more theater or concerts or professional bull riding from time to time. So definitely stay in touch with all the events that take place here because they'll probably be bordering our campus as there are several event venues that do. We even have the DCU Center, which is right in between our campus that has not only plenty of touring shows coming through, but it's also home to our hockey team. We have a hockey team and a baseball team here in Worcester, and they are minor league affiliate teams, but we are lucky to get free tickets to them for seasonal college nights that they do host. So our students do get to see a wide variety of events and sporting events at that while they are in this area. And we're also known as being a foodie city. There's plenty of great food nearby. A lot of that is due to how diverse Worcester is. There's over 30 languages spoken here, and I think that's really celebrated through the different types of cuisine that you'll find in the city. So I think that really adds to the charm of the city as well, is that we're not super gentrified where there's like 1,000,001 chain restaurants around. It really adds to the charm that these are all like independently owned mom and pop style restaurants and shops. But don't get me wrong, you will still find Chick-fil-A down the road if that's more your jam. So there is something for everyone. But I'd love to turn it over to Budamina since she is, a student here in Worcester and gets to experience this culture and this area on her daily basis. So what is your favorite thing to do in Worcester when you have some downtime?
Yeah, so I am a coffee addict or fanatic. So I love to explore the local coffee shops in the area. And thankfully, around our campus, there's quite many coffee shops. So I like to go there, kind of bring some of my friends with me. We go do a little bit of work there and we try out all their new flavors. They're always getting new seasonal menus, which is a lot of fun to try out all these different new flavors. I also love going on like mental health walks because given like the rigor of our program, some days like you just kind of need like maybe 10-20 minutes to yourself to kind of de-stress. So I like to go visit like the local colleges in the area, kind of take a little lap around their campus. I also went to college in Worcester, so I like to go back to my alma mater, go see a basketball game or a football game. That's always a lot of fun.
Excellent. And you probably have your finger on the pulse quite well, given that lived in Worcester for several years now.
I
So I'm
definitely
sure she's got some great recommendations up her sleeve if anyone wants to know about some fun things to do in the area if they're ever visiting. One of my favorite things about Worcester is that there are a lot of great rural communities that surround it too. So if you wanted to get out of the hustle and bustle of it all, you can easily get outside and go hiking or mountain biking or even skiing and snowboarding in the colder months, as we do have a ski mountain that's only 25 minutes away from our campus called Mount Wachusett. So no matter what the season is, there's always something fun to do, whether you're looking to do something within the city or a short drive. Plenty of fun to have if you happen to have some free time. I also like to share too that we have plenty of public transportation in the city. So although this is an urban city, we do have a city bus that you can utilize, and it's free to utilize city bus. But most students do choose to bring a car. We can accommodate parking. So most students, I would say, do choose to bring a car to campus, but it is possible to get by without one. Through the city bus and also the commuter rail that we have. There is a commuter rail that runs directly between Worcester and Boston several times a day. So if you ever wanted to take a day trip into the big city, you certainly can. There also is Amtrak and Greyhound out of Union Station, so you can get connected to other parts of New England and beyond through public transportation. And another thing that we can accommodate is housing. So this is kind of a big selling point to the MCPHS Worcester campus, especially for students that live outside of New England, is that we can accommodate housing for you. We can guarantee it for all 4 years of the program if you wanted to stay on campus that long. I'd say most do choose to move out for externship because their externships could be really all over the country. So that's your time to kind of travel. But if you do need a place to live, we've got you covered. We have 5 different residential areas to choose from, ranging from studios all the way through to multi-bedroom apartments. And no matter where you choose to live, your room is going to be private. We get that you're past that undergraduate experience of, sharing a room with a stranger. And this is mostly a graduate level campus anyways. So no matter where you choose to live, you will have your own privacy of your room. You just might have to share a bathroom or kitchen space with other students, at least depending on the accommodation that you choose. And a lot of our optometry students do choose to live at Lincoln Square in particular. So this is one of 5 of our residential areas. It was previously a hotel. So the hotel portion of the building is our residence hall, where you have your own room and bathroom, much like hotel style would be. And you would just share a community kitchen with the rest of the residents. And everything that you need for optometry is just downstairs. So the clinic's downstairs, your labs, the classroom spaces. So when the weather isn't too nice out and there's a blizzard going on, no worries for you. You just have to go into an elevator to go downstairs and get to class. So it's pretty great to have everything so close by. We do have 4 other accommodations that are maybe maximum a 15-minute walk to the optometry building. So everything is in close proximity nonetheless. All units do come furnished, and everything in the utilities are included in the cost of the rent. So it is super simple to choose to live on campus. We do also have partner housing available. So if you were looking to move with a significant other, that is also something that we can accommodate for you. So next is a little snapshot of the different programs that we have that take place here on our Worcester campus. So we have both Eastern and Western medicine that take place out of this campus, ranging from not only optometry, but to physician assistant studies, physical therapy, occupational therapy, dental hygiene, diagnostic medical sonography, nursing, pharmacy, and acupuncture. And we do bring all these programs together once a semester for what we call interprofessional education, or IPE. And this is really the university's take on sort of alleviating the current state of the healthcare system for future generations of healthcare professionals. So while you're never actually going to have class with any other students besides optometry students, you at least get the opportunity to collaborate interdisciplinary with these other programs at least once a semester through these IPE initiatives. In the past, we've done like an emergency medicine Narcan training. We've done a dementia simulation, even a diabetes maintenance training, all sort of centered around the idea that no matter which profession you're part of, you're going to encounter patients who have maybe struggled with addiction, or who have dementia, or who have diabetes. So this just allows you to understand, from your own area of expertise, how you best can support these patients, and also how your colleagues from these other areas are also able to intervene to provide support. Because after all, healthcare is highly collaborative. So that is something that we try to instill at the student level. And we are advantageous in that we have all these healthcare programs at our disposal. So we make use of them and try to provide some real world scenarios that you may encounter within your career. Now, Budamina, I know you've only completed 2 semesters so far, but I'm sure that there's been a little bit of IPE sprinkled in there. Would you be able to share a little bit about your experiences participating in our various IPE events so far?
Yeah, so I've had the opportunity to attend one IPE. The premise of the IPE was to kind of talk with our colleagues and figure out who can give vaccines, who can prescribe drugs, who can do certain things within their scope of practice. And it was a really great talk. It was discussion based. I got to learn what all of my colleagues were able to do and what they couldn't do. And so that was great. It's very important. Good to take with me down the road when I refer my patients out to these other providers. One of the best things that's came out of the IPE is the friendships. A lot of the people I was sitting with, I got to know, and I see them in the hallways, and we say hi to each other. We check in with each other, so that's been really great.
Fantastic. That's definitely one of our more introductory ones for first year students, is just to kind of get the ball rolling, to get you guys familiarized with some of the different not only programs that we have here at MCPHS, but those that you might encounter within your career, and just understanding, okay, what exactly does an occupational therapist do? And how might there be some overlap with the patients we see in optometry, et cetera. So it is nice to kind of come together and also meet some friends that maybe aren't in the optometry program and kind of hear from their perspective a bit more. So definitely is a great way to bring the community together for all things healthcare. And next, I want to shift some gears and talk about our optometry program, which you all came here for, of course. So our optometry program is just under 4 years in length, and it starts every fall. We launch our new cohort every fall. September 2nd is our upcoming term start for fall of 2026. And our cohort size is 64 students each year. We do like this number because it breaks down nicely into 16 students per lab. And when our students are in the lab space, they have support from 2, if not more, faculty members at a time. So it's more like an 8-to-1 student to faculty ratio, at least in the lab setting. So we're pretty much a small to mid-sized cohort. And we also have the opportunity for you to pursue a dual degree if you wanted to. I like to call this our buy one, get one deal, a bit of a BOGO for you if you're looking to complete a Master of Public Health. This is entirely online through MCPHS, and it doesn't start until your 3rd semester of the program. So you at least get your first 2 semesters of the program just to make sure that you're transitioning well into the curriculum before you put too much on your plate. But if you do decide to pursue the Master of Public Health, it just adds one additional online course starting in semester 3, and it is an asynchronous course. So you get your assignments at the beginning of the week, and then you have typically until Sunday at midnight to submit everything. So it does still allow you to put optometry first and then finish up the week with whatever else you had for the MPH. And this is a great credential to add to your tool belt, especially if you're looking to go into education or access and advocacy. And if you ultimately decide that you maybe just want to focus on optometry, anyone who graduates from the MCPHS optometry program is eligible for our alumni scholarship. So you can always do the Master of Public Health after you graduate under our alumni scholarship for a 50% off tuition scholarship. And you can also do other master's degree programs that we have. It doesn't necessarily have to be the MPH. The alumni scholarship is also eligible to be used for MBA in healthcare management or Master of Clinical Research, which are all great complementary degrees depending on which direction you're looking to take your career. But other than that, I did want to also share a little bit about residency. So we have actually had a strong track record at getting students matched with an optometric residency. We've been consistently above national average for the last several years. So residency is something that you don't have to decide on right away, but if you are really interested in pursuing a certain specialty, or maybe you want to teach one day, a residency is a great way to hyper accelerate your resume. They say that like 1 year of a residency is equivalent to like 5 years of working experience. So as you are gearing up to enter your career as an optometrist, we can certainly help you to start applying to those residency programs and looking at other opportunities that might interest you. So we might be jumping ahead of ourselves a little bit by talking about residency, because we're going to be talking about year 1 next for what you can expect as you're starting as a first-year optometry student. And who better to take us through that than Budamina? So would you mind telling us all about what went on during your first year of the program?
Yeah, so the first year of our program is mostly a foundational year. We spend a lot of our time and our focus in the classroom and lectures, learning kind of the basic foundation of the optometric career. We also have a lot of labs where we get to be very hands-on. We have anatomy lab, we can touch a lot of specimens, which is really great. And one of the really unique things about our program is that as early as the 4th semester, we are actually in the clinic, seeing patients and kind of like just being in the air of the clinic. So so 2 experiences I've had in the EVC so far is that I have had an appointment as a patient. So I got to be in the chair, having the 3rd years kind of work on me, figuring out kind of what's going on with my eyes. And then we also had the opportunity to shadow. So we got to kind of be a student clinician, seeing how the 3rd years make their clinical decisions, which has been really great.
Fantastic. And I know you also went through Jumpstart. Can you tell us a little bit about that?
Yeah, so Jumpstart's really great because there's a pretty hard line, I would say, between like kind of like the undergrad experience and the graduate school experience. Graduate school is like very much, it's extremely accelerated. And so what Jumpstart did for us is it kind of prepared us for that acceleration of kind of like learning and all the exams. And so every Jumpstart session had a theme. So for example, like one of them was like how do I time manage more efficiently? So our professors provided us with resources and other upperclassmen students to tell us about how to manage your time better and how to really like how to study, which is really great because the way you study in undergrad is very different than the way you study in graduate school. So all of them are very topic based. There's a goal at the end of each session. There was also one that we had that kind of discussed how to take advice. So how to accept that graciously to kind of become a better clinician in the long run.
Fantastic. Thank you so much. So Jumpstart is something that we've added to the program over the last couple of years just to really help with the transition into graduate school. Like Budamina said, there's a lot of difference between undergrad and grad school. So we wanted to make sure that you all had the tools that you needed to be successful in this type of curriculum. So Jumpstart starts just before orientation. Our students that are, our starting cohort come in with a summer reading assignment. It's usually, I think the book is called Learning How to Learn, and it may seem really elementary in essence, but ultimately we're giving you the tools that you need that, match your own individual learning styles to help you tackle this type of curriculum. So everyone takes something from every Jumpstart session, whether it's study skills, study habits, when to study, time management, taking advice, things like that. And these Jumpstart sessions do grow with you. They do even go into year 2. And your last Jumpstart sessions will be more focused on helping you to see patients on your own. Because the big factor of year 2 is that you get to start seeing patients as soon as your 4th semester. So your first semester of second year, you're doing basic primary care types of exams in our on-campus Eye and Vision Center. Also in year 2, you will start visiting our local public schools. So we see kids K through 12 in the Worcester community, and our students will go to these schools to give basic vision screenings. And if these kiddos, don't pass our basic vision screening, we will bus them over to our campus to sit for a full comprehensive exam. And this is one way that we're able to give back to our community. We'll give them glasses at no cost, no questions asked about insurance. So a really great way to work with the local kiddos and give them some glasses that they might need to, continue to be able to progress through their own studies, just like you guys will be progressing through your studies here in optometry school. Then once we get to year 3, this is going to be a big focus on specialty clinics. So we do have a lot of different specialty clinics that you'll get exposed to throughout year 3, including pediatrics, binocular vision, low vision, glaucoma, contact lens, dry eyes, lasers even. We do teach the full scope of practice of an optometrist, and some skills you will be able to practice in certain states, whereas other states may restrict certain skills. So when I say that, I'm mainly referring to skills like lasers, which you actually can't practice in the state of Massachusetts. It's more reserved for ophthalmologists. But other states do allow optometrists to utilize lasers in their treatment. So we do teach the full scope of practice so that you'll be ready to utilize whichever skill, no matter which state that you'll be practicing in the future. So rest assured, you'll get everything covered while you're here. Also in year 3, you'll start to visit our local community health centers and serve patients over there. We have 3 off-campus community health centers. One is in Worcester, one's in Framingham, and one's in Milford. So I'd say they're maybe about a 30-minute radius or so from our Worcester campus. And we see a lot of ocular disease in particular in our community health centers. So you'll get to work with a lot of patients who are maybe coming from other countries or other areas that maybe you'll sometimes see even some ocular disease that's not commonly found here in the US. So you get exposed to quite a lot within our clinics themselves. And we often work with patients who may be learning English as a second language. So we rely on interpreter services quite frequently in our community health centers as well. So that really helps to bridge that language barrier to make sure that you're able to provide as comprehensive of an exam as possible. And another big feature of year 3 is national boards. So of course, to become an optometrist, you do have to take 3 parts of national board exams to pass to get licensed. And part 1 typically comes at the end of year 3. So in the fall semester of year 3, to prep students for taking part 1, we do have a boards review course that they will participate in as part of the curriculum in the fall semester of year 3. And typically in the spring semester of year 3, they take part 1. In addition to the boards review course, we also purchase a boards prep course that students can utilize on their own time to help prep for part 1. And then year 4 is also going to be dedicated to parts 2 and 3 of national board exams. So part 2 is more of a case-based exam. To prep for that, we have a Blackboard organization with all sorts of different case questions and practice exams for you to go through to get familiarized with it and test your knowledge. And part 3 is an in-person exam that you have to go to North Carolina for specifically to take. So we actually have our own designated room on campus called our part 3 room that students will get assigned to. And they'll do like a mock exam that will be recorded. And our faculty members will review the recording and kind of provide them with some feedback as to how they can improve before they head out to North Carolina to take the exam. And we have the same exact equipment on campus in its own designated room that you'll experience when you go to North Carolina. So that really does help to just get you to feel a lot more confident heading into the exam, having been more familiarized with the format and the equipment that you'll be using. So that's something that you can anticipate taking parts 2 and 3 during year 4. But year 4, you'll be actually off campus for the most part, going on your externship rotations. So that is the bulk of year 4 is 3 16-week externship rotations. One will be at a community health center, one will be at a VA working with veterans, and then one is an elective of your choice. So if you are interested in specializing at that point, that is your opportunity to do so. We have externship sites all across the country. We have over 70 partnerships. So you could go as far west as California, even rural Alaska, as far south as Texas and Florida, and really everywhere in between. And you will work with the clinical coordinator on your preferences. So they will certainly take your preferences into consideration. We're not just going to send you to rural Alaska unless you ask to go there, of course. But from what I hear, that's a very popular one. So you might have to fight a little bit for that one. And regarding residency applications and capstone projects, I'm going to pass this over to Dr. Imperioli to share about some other features of year 4 that you can anticipate.
Sure. The capstone project actually is one of the faculty's favorites because we love to watch our students presenting their capstone project. So what it is basically is during your 4th-year rotation, you take an interesting patient case that was seen by the student and preceptor on rotation. You create a poster presentation and then present it during a webinar at the end of the 4th year before graduation. And the webinar is open to all faculty, all staff, all of the students that are on campus. So it's really very exciting to watch our students present. And then the students are also encouraged to submit the poster to the Academy of Optometry. And if accepted, they can travel to Academy and present the case on a much bigger scale as well. So capstone is always a favorite for sure. It's also nice for the students to, because it's in webinar format, a lot of the students in the 4th-year class that haven't seen each other all year because they've been at different sites get together again and listen to each other's presentation. So that's a lot of fun. Residency. So applications are done and due during your 4th year. So we really encourage our students to think about doing residencies. It's not required to practice as an optometrist, but like you were saying earlier, Hannah, if somebody is interested in teaching, so in an academic setting, then a residency typically is required. So that's a big plus. So we do encourage our students to seriously think about residencies. We have a residency fair that is conducted every year, and it's usually done before students go off on rotation, but it's open to 2nd-year and 3rd-year students right here on campus to get the students thinking about residencies. A whole bunch of faculty, both at the school and some outside the school, are encouraged to come in and talk about their own experiences with residency, applying for residency, different types of specialties of residency, etc. So a lot of students enjoy that, gets them thinking about it, because once you get into your 4th year, that's when you have to apply. So it's kind of nice nice to think about it ahead of time so that if you are interested, what type of residency would you like to apply to? And that is done in your fourth year. So a lot of exciting stuff happens during that fourth year.
Yeah, a busy year, but a rewarding year nonetheless.
Yeah.
And Dr. Imperioli, since your stomping grounds are basically 10 Lincoln Square, where all of our facilities take place, would you mind sharing a little bit more about our facilities and the various amenities as part of the optometry program?
Yeah, definitely. So I'll start with our pre-clinic. Our pre-clinic is really kind of special in that it is 2 rooms, 8 lanes in each room, so 16 lanes total. And lanes meaning that, there are these lanes that are equipped with all of the basic essentials that you need to conduct a comprehensive eye exam. The pre-clinic is where we have our labs, but it's also open 24 hours a day, 7 days a week to students so that they can go in and practice after hours. There are some of our um, courses, so our optometric theory and methods courses that teach the components of a routine eye exam. Some of them require drops for those procedures, but we have professional tutors that we have come on campus set hours, evenings and on weekends, so that students have the opportunity to practice those skills as well. We have a simulation lab for binocular and direct. It's a procedure that allows us to take a look at the back part of the eye, the retina with dilated pupils. So we have a simulation lab, the VR
Actually
magic.
pictured here.
Oh, yeah, it is. Exactly. So that in order to do this procedure, the student has to have a dilated patient. And sometimes that's not easy to do. So sometimes the students just want to come down and practice on their own at 10 o'clock at night and not dilate the patient. So it's kind of nice to have that as an extra. We also have, as you had mentioned earlier, the part 3 boardroom. So it's a room that's set up exactly like the national boards has their room set up, same equipment, same slit lamp, same everything, so that students can practice on it. And we do start students early on that, so well before they get to the point where they have to go and take part 3. We have equipment such that so that students can record themselves, as you had mentioned earlier, and that's really a big teaching these courses. I'm a big fan of the ability for students to record themselves doing these procedures. That way they can play it back and see what they did right, what maybe needs a little bit more work. And then we as instructors can look at it and give, real feedback. So I do love that part. And that's all sort of the pre-clinic. Clinic on the in the EVC is where, so right on campus is where students will do their specialty clinic. So contact lens, pediatrics, glaucoma, low vision, traumatic brain injury, binocular vision, dry eye clinic, all the specialties, including primary care, is done on campus. We also have those 3 offsites, primary care at the community health centers, but here at the EVC, it's all the specialties plus primary care. And we have all the, again, all the necessary technology to support all of the specialty clinics. So there's a lot of extra auxiliary testing that goes along with those specialties that we have right here on campus, which is really very nice and very convenient for the students. So it's not till 3rd year that students start rotating through those community health centers for primary care there as well. But it's great having the majority of what students need right here at 10 Lincoln.
Absolutely. Well, thank you for taking us through all of those facilities that we have. Another question that we often get is, are there research opportunities available for students? And the short answer is yes. We won't make you do research, but if that is something that you're interested in doing, we have plenty of opportunities for you to do so. It is actually a requirement for our faculty to be involved in research to some extent, so you can always get paired with a faculty member on their research or even design and perform your own research with a faculty mentor. We have university research funding available, and we are big advocates for you to present your research at like local and national conferences and such. In the past, we have done some research in collaboration with some of the different programs that we have here at MCPHS. There was one that we did with our pharmacy students where we looked at artificial tears to treat dry eyes. We've done some work with our occupational therapy students using virtual reality as a form of vision therapy. And we even have some external research partners. And I'd like to pass it over to Dr. Imperioli to talk a little bit more about some of the research we've conducted over the last couple of years, if you wouldn't mind.
Yeah, no, I'd love to. We do have an associate dean for research, Dr. Larry Bache. So we really do, again, like you said, research is not required, but if there's anything that kind of piques a student's interest, maybe we're not currently doing research on that particular topic, but if they have a particular interest, there's always Dr. Bache is always willing to help them out with that, and certainly faculty is always willing to help. As far as some of the big research projects going on, probably the biggest one is the one that involves Peliprism and low vision clinic that we're doing with Harvard currently. That's a big one. We have ongoing research at UMass with the macular degeneration. So some of the injections that are used to help slow progression of certain forms of macular degeneration, they're kind of looking into whether or not those can be used for other similar types of degeneration. If students are interested in pursuing the public health degree as well, there's always research that's conducted with that as well. So there's so many different avenues. I guess the biggest point to make is that if you have any sort of interest in research at all, it's something that you can definitely look into here. We welcome it. And again, it is sometimes a really nice thing for students to do and pursue.
Absolutely. Plenty of research to go around if that's your jam. All right, so hopefully this all sounds super exciting to you all and you are interested in submitting an application in the future. So I'm going to talk to you a little bit about what that will look like. All of our applications do go through OptumCAS. So this is a centralized application system that, no matter which optometry school you're applying to, you will ultimately have to start an OptumCAS application. If you ever applied through the Common App in undergraduate, or I guess from high school applying to undergraduate institutions, you probably have applied through a similar type of platform. But essentially, OptumCAS just makes sure that they have all the information on you that they require before they distribute your application off to the schools that you're applying to. So for your application, we do require all college transcripts. Even if you've completed a random community college course one summer, we do still require that as part of your application. So please don't forget to include this on your application because it can delay the review of your application if you are missing a transcript. So make sure that all college transcripts are recorded and submitted to OptumCAS. We prefer a bachelor's degree, at least in progress at the time of your application. Typically, I would say most students have a bachelor's degree that they'll earn before they matriculate into our program, but it is still possible to apply to start the program with at least 90 college credits. So there are a small handful of applicants who are just, looking to get started as soon as possible and have everything in order to complete their application and start the program a year before they graduate. So you don't necessarily need a bachelor's degree, but it is preferred that students come in with one. But at minimum, we need 90 college credits by the time that you start. For your GPA, we are really looking for applicants who have a GPA of a 3.0 and above. And with that, we are also going to consider a test score. Primarily, students will submit an OAT exam, which is the optometry admissions test, but we will also consider the GRE, the DAT, and the MCAT. And regardless of which test type that you take, we are looking for scores in the 50th percentile and above. However, we do really have a holistic approach to the application review process. So even if you, don't quite have a 3.0 GPA or don't quite meet the 50th percentile on the GRE, OAT, whichever exam you're taking, that wouldn't be a reason to not apply. It does still help to put in an application, because we can see your merits in other ways. So maybe you struggled your freshman year, but have really had an upward grade trend since then. Or maybe you've had stellar OAT scores to make up for your previous academic history or whatnot. So we can really choose to see your strengths in other ways. But we really are looking for proof that students will be able to do well in this type of curriculum, as their academic performance can allude to, as well as their test scores. So with that, if you're slightly below, I'd still encourage you to apply, because we do allow candidates to improve their application throughout the cycle by submitting new test scores or new grades that can help to improve their application over time. We also recommend that you get some experience before applying. We see a lot of students that will get some experience shadowing, which is totally fine. You can also get some work experience as an optometric assistant or a tech. So really anything that allows you to be able to observe the daily responsibilities of an optometrist will be useful in your application, because if you ever come for an interview, that's what we're really looking to understand is, why do you want to be an optometrist? What about the career attracts you based on their daily responsibilities? How does that align with your future career goals? So shadowing is a great way to better articulate your thoughts for becoming an optometrist. And I always use the analogy, if you want to buy a car, you're going to want to test drive it. So the same goes with your career. We highly encourage you to get some sort of experience before completing your application. We also require a variety of prerequisite courses for entry into the optometry program. These include biology 1 and 2, chemistry 1 and 2, physics 1 and 2, and microbiology with lab, all of those with lab, as well as calculus, statistics, 2 English courses, and psychology. Those are all listed on our website under the admission requirements for the Doctor of Optometry program, if you wanted to see a complete listing there. But you are still welcome to apply with a couple of courses in progress. Just note that all prerequisite courses do need to be complete by August 1st before you do start the program. We also require a couple of letters of recommendation. We need at least 1 letter of recommendation if you're to move to interview for the program. We prefer to see 2 to 3 on file. So these should be professional in nature. So if they are coming from a manager or supervisor who can really speak to your work ethic, that's great. If they're coming from an academic advisor or a professor who can really speak to your academic performance, we love to see that, as well as one from an optometrist, if you can get one, who can really speak to your work in the optometry field thus far. I would definitely recommend sticking to appointing individuals to write you a letter of recommendation who truly know you and have worked alongside of you for a good amount of time, that can put in a good letter for you or a good recommendation for you. There are times when I see letters of recommendation from individuals who clearly don't know the applicant all that well. So I would encourage you to stick to letters of recommendation that are of quality, not necessarily of quantity. And if you have completed any coursework outside of the US or Canada, we do typically require a WES or an ECE evaluation to translate your coursework into a US equivalency. So if you have any questions about that, I'm happy to help point you in the right direction. And if you meet our minimum requirements, we may offer an invitation to interview with us. And our interviews are either in person or virtual through Zoom, and you can opt for whichever type you would like. So here are some important dates that are coming up. So we, of course, are at the tail end of our fall of 2026 cycle. That closes on May 21st. And we are gearing up for the start of our fall of 2027 cycle. Believe it or not, that application opens as soon as June 25th. And we will be receiving applications all throughout the summer, and we'll begin the interview process likely in August or early September. So that cycle is already almost at its start for us here. So our recommendation for you is always to apply early, because we do review applications on a rolling basis. So that means as we receive applications, we review them and invite to interview and offer decisions following the interview from there. Ways to stand out for your application is through the GPA, of course. Again, we look for a 3.0 and above. We're not just going to look at your cumulative GPA, which is something that OptumCAS calculates for us, but we are also going to look at your total science GPA as well as your prerequisite GPA. Your prerequisite GPA is something that we calculate on our own by taking your highest grade earned in a prerequisite equivalent course and kind of calculating a GPA from there. We also want to see that you've expressed an interest and a passion for the field of optometry, which you can convey to us through your supplemental questions in the personal statement, as well as through your experiences. So this is ultimately our opportunity to hear from you, hear your voice. So don't overlook these questions that you'll be asked as part of the application, because it does go a long way to show that you have done some research on our program. If you've attended today's info session, you've probably learned a few things that can add to some talking points on your application. So make sure that you really tell us, why you want to come to MCPHS in particular. We do love to see applicants who have truly gone above and beyond to showcase these thoughts with us. And also the timing of the application is important. It is a long cycle, so our application is typically open from the end of June all the way through to May the next year. But don't wait to apply, because as we get into the spring semester, our seats do become limited. So I would encourage you to apply sooner rather than later. That doesn't mean that you need to apply, right away as soon as June 25th hits. Certainly take the time that you need to prepare for the OAT and submit a quality application, but also don't wait too long to the point where seats aren't available. So there is plenty of time to apply throughout the upcoming cycle, but just don't wait till last minute. So if you are a domestic student, you certainly can apply for financial aid through the FAFSA. There are some changes to the FAFSA that will be affecting future classes, where there is a cap on funding that you can receive through FAFSA, and this is something that will apply to all optometry schools moving forward. So the FAFSA will award up to $200,000 towards your funding for optometry studies. So that can cover definitely a great chunk of the program, but if you do want to borrow for cost of living, you may ultimately need to rely on also borrowing some private loans to help towards the tail end of your studies here, if you do end up utilizing the majority of your funding through FAFSA. But if you wanted to speak more individually on what your situation would look like, we have affordability appointments available with our student financial services team. They're more than willing to sit down with you at any point to kind of discuss, what you can expect through financing an optometry program and what options are available to you. But the good news is that we also offer we also offer scholarships. So anyone who is accepted into our optometry program is awarded something. Right now, we are giving awards of up to $15,000 per year, and this is typically based on your GPA, but we also have some faculty members who might put in a good word for you following your interview. So there are a couple of factors that go into your scholarship award. So that definitely does help to offset the costs that are associated with your optometry studies. And last but not least is some helpful contact info for you all. I want to share too that I know you're joining us virtually to learn about the program currently, but if you do ever want to visit us on campus, we do have campus tours that we offer regularly on select Mondays, Fridays, and even some Saturdays. So if you ever find yourself in the Worcester area, do let us know and we'd be happy to host you for a tour. In addition to that, we have a virtual tour on our website where you can click around and sort of get an idea of how our campus is laid out. But I would say for now, our YouTube channel and our Instagram pages are a great resource. So MCPHS TV and at MCPHS Admissions for our YouTube channel. And in particular, at MCPHS Opto is going to be the best location to see all of what's been going on within our optometry program on our Instagram page. So feel free to check us out there. And in addition, if you want to stay in touch with any information about the program, if you want to scan that QR code, we'll certainly get you on our mailing list. And I also offer one-on-one appointments in the future if anyone would like to discuss their candidacy individually, so feel free to reach out to me directly by email or phone. Happy to help, and hope to meet any of you that are future applicants soon. I also am happy to connect with any of our current students like Budamina if you had any questions for the student perspective, or to Dr. Imperioli if you wanted to hear more from our faculty members. We do also offer shadowing on campus if you ever wanted to visit our clinic and do some shadowing or shadow a class even. So let us know how we best can support you. We'd be happy to help. Thank you all for joining us, and we look forward to I guess hearing from you all in the future or receiving your application. So thank you so much and take care. Bye now.